This is Average Joe PT, where this channel is all about physical therapy, a little bit of entertainment, a little bit of fitness, and hopefully some education to help you along with your day, to hopefully make it a little bit brighter and make you smile a little bit. Now, today's discussion is about chronic lower back pain. Basically, most of America anyways, and I'm sure around the whole world, if other people are watching this, you're going to deal with low back pain at some point in your life. It might be severe, it might be mild. But today we're going to talk about some basic exercises and some modalities that you can do, at least in the short term, to help reduce your lower back pain. Now, people will have ebbs and flows or ups and downs in their lower back pain. And so what you want to do is kind of figure out, all right, what's making my back pain worse and what's making it better. And so today I hope to give you some information and some discussion on ways that you can help reduce your pain in your lower back and hopefully make your day a little bit brighter. So let's go ahead and get started with some basic exercises. Here we go. Now, before we get started with those exercises, there's a few discussionary little details that I have to tell you about. Discussion number one. If you're having any leg symptoms, which is any neuropathic symptoms or arm symptoms, these exercises are not going to be appropriate for you. That's for a later discussion. We can talk about McKenzie's approach, which is a certain types of philosophy or technique to help reduce your radicular symptoms. I'm sure I'll have a web discussion on that or a YouTube channel discussion about that at some point in time, probably in the near future, at least in the next couple weeks. So stay tuned for that one. But so let's take that out of the equation. If you're not having any leg symptoms, no numbness, no tingling or anything like that, and you're just having some lower back pain and maybe some pain that's in the hip a little bit, these are some of the exercises that you can do, at least stretching wise, to help mitigate and reduce your pain, as well as give you some ideas on modalities that you can also do at home to help reduce your symptoms. So let's go ahead and now we'll show you those exercises that you can do at home. Let's go ahead and we're going to talk about those 3 exercises or 4 exercises that I want you to try and do if you're just having some lower back pain that seems to come and go. Now, as I discussed before, you're not going to have any left or right leg symptoms. You're just going to have some lower back and maybe in the right or left hip a little bit. All right, so this is people that don't have any sciatica symptoms, okay? If you're having sciatica symptoms or neuropathic nerve symptoms, these are not the exercises for you. All right, so exercise number 1 is going to be just bringing one knee towards the chest, going to hold for about 30 seconds to a minute, and then relax, then switch and do the other one. All right, so as in my last discussion, 30 seconds to a minute is the maximum time limit that you want to do. You want to hold that stretch where it's comfortable. You want to go to the point where you feel a stretch, but you don't want to go into the stretch. Second exercise you want to do is called the hamstring stretch. You're going to gently just kind of straighten your knee out, keep your foot relaxed. Same thing, 30 seconds to a minute. Come down, switch. Underneath, you can clasp if you want to, and then straighten out. Now, sometimes people will use a towel or a sheet because they can't get their arms around. You can do that to kind of straighten your leg out, all right? But this will be your exercise number 2, all right? Exercise number 3 is going to be where you come across and you pull the knee to the opposite shoulder, all right? It's going to go, in this case, right knee, left shoulder. You're going to hold this exercise for 30 seconds to a minute, and then you're going to switch and do the other side. You're going to hold that. So you feel a big stretch right in the hips, all right, depending on which side that you're stretching. In this case, I'm stretching the left side. All right, that's exercise number 3. Now, the last exercise, you want to be on your hands and knees. Some people call this the prayer stretch or yoga, depending on what exercise philosophy you're going by, but your hands are going to come apart, shoulder width and knee shoulder width, and you're just going to gently come back, kind of hold for 30 seconds to a minute, and then come up and rest. And then you're going to repeat. Now you can go ahead, some people like to switch it so both hands are on one side so you get a stretch, and then you can switch and do the same thing on the other side. So those are 4 exercises that you can do if you have some chronic lower back pain. All right, so let's go ahead. We're going to finish up some discussion on certain modalities that you can do to help reduce that chronic lower back pain. So let's go ahead and get started with that. Now that we've shown you some exercises that you can do at home with some chronic lower back pain, some modalities that you can use are the obvious ones. You want ice or heat the lower back. I usually say heat the back for maybe 10 or 15 minutes prior to doing the exercises, and then maybe ice it 10 or 15 minutes after. As always, I'm not a fan of recliner chairs, so with any type of lower back pain, stay out of the recliner chair, stay out of prolonged sitting for a long time, okay? That'll just irritate your lower back even more. I'd rather have you either lying on your side with pillows between your knees, or maybe go ahead and lie on your back with pillows underneath your knees for a little bit. Or in some cases, if you're comfortable enough, maybe lie on your stomach with 1 or 2 pillows at the belly button to help support that lower back, just to get you out of that sitting position. Like I said before in other channels in videos, stay away from that letter C for the lower back, because all you're doing is stressing your back more and just kind of sagging down. And that's the worst thing that you can do for your back. All right, so I'm going to show you a little bit of anatomy in that lesson just to kind of give you an idea what I'm talking about. All right, and then we'll go ahead and we'll finish up this episode. So a little anatomy discussion. So I'm going to set up 2 pictures for you to see at. Okay, and so when you look at the lower lumbar spine or the lower back, all right, there's 5 vertebrae. All right, L1, L2, L3, L4, L5. L means lumbar, all right. And then after L5 is S1, which is sacroiliac 1, and then your solid bone through that part. And then at the very bottom is the coccyx. So between those vertebrae, as everybody usually knows, common knowledge, is that there's a disc, all right, and those discs are squishy. And as we age, they start to stay flattened out, and that can give you a little bit of back pain. Those little bones on the sides, okay, those little ear-like things, those are called your facet joints, all right, or Z joints or zygapophyseal joint if you want to be real fancy, all right. But essentially, those joints actually glide up and down each of those bones. So L1 has the Z joints that slide on L2, and L2 slides on L3, and so on and so forth. And so over time, you can get pain in those and get inflamed, and they can get arthritic. All right, that's also known as facet joint syndrome. All right, and they do all types of treatment for that, and we can discuss that in another episode, as well as an episode about disc issues. But I just want to give you the gist of where your lower back pain could be coming from. But in this episode, we talked about just lower back chronic pain without any leg symptoms, all right? So those exercises earlier were just for people who have just some lower back pain, all right? So stay tuned for another episode, all right? Subscribe down below so I can keep doing this content, all right? And hit the bell, all right? That's nice to see some further videos. I try and do videos at least 3 or 4 times a week, all right? On physical therapy, fitness, and things that you can do at home. All right, so stay tuned, and like I always say, look up and keep smiling.